And here is the screen, and here are the questions to the article about concordance. So, do you see the slide?
Yes, ma'am.
Yes.
So I think the next person just to read, to answer the questions is Aymen. Aymen, please, the second question.
Yes, ma'am. The question is, which medicines are least likely to be taken by patients?
Mhm.
Ma'am,
Okay, so the medicines that are least likely to be taken. So there is.
ma'am, actually, patients do not take medicines which are like for the asymptomatic diseases or discomforts.
So there is information here. So preventive medicines, right?
Preventive medicine.
Mhm. Okay. And so the next is for Arun Chalam. Question number 3, please.
Yes, ma'am. Which group is more likely not to take the medicine prescribed because they do not believe the illness is there?
Mhm.
Yes, ma'am.
They do not
This
believe.
because they thought that medicines is for preventive purpose and it's not for curing. So those group they didn't take it.
So there is information about this group of people in on this slide. So they
Yes,
do
ma'am.
not believe in the existence of illness. So which group of people?
Can I?
Yes.
Yes, ma'am. Younger people, ma'am, like they deny the illness, and older people due to physical difficulties and confusion, like they don't like don't use the medicine.
And these people,
We
these
are
people, they
speaking.
mostly thought that
Yes,
is
we are
for
speaking
only
about
preventive
people
purposes.
who do not believe in the disease.
Medicines.
So they deny the disease.
Yes, ma'am.
This is a group of younger people.
As for myself, they deny the medicine also, ma'am.
Yes, okay. And the next question is for Madhumita.
Besides providing information, what effective ways can improve compliance?
Okay, if we go to this slide.
The practical and emotional behavior, the supportive interventions that like those.
So educate the patients, support them emotionally and behaviorally, and introduce what? Some self-management programs. Okay, that was who was that? Madhumita, yes. Now Priya, the next question is for you.
Yes, ma'am. What is more important than increasing compliance in patient? Ma'am, increasing compliance with prescribing instruction is not as important as meeting patient individual needs and properties.
Yes, exactly. So this piece of information about patients, yes, individual needs and priorities. Okay. And let us listen to Prerna.
Yes, ma'am. What do patients need to be helped to make? Ma'am, patient should be, or the doctors or whoever is it, the patient should be given the priorities and the choices of their treatment, so that they can completely get into their procedure.
Yes, so they should make their own choice. Free choice, informed choice. Yes,
Yes, ma'am.
that is if it as
About
it is said. Uh-huh.
their treatment.
I see. Okay. And let us listen to Nishat.
Yes, ma'am. Like what can be of help to both the individual and general population? Ma'am, like improvement in self-management skills and compliances in the field of medicine. It can benefit both the population as well as individual at the same time, and like also combining medication, and like it supports the patient and it helps to improve like in their abilities to take like action against their difficulties like the medicines.
Yes. I hope that you remember this just technique, how to improve the concordance, and you'll use it effectively in your real medical practice while working with patients. So you should keep in mind this information. And so if we move to the next slide, there is some cartoon about side effects of AstraZeneca. And the doctor just says there's the shortness of breath, chills, and sweating and trembling, but the nurse hasn't injected the patient yet. So this is what the doctors just expect. That the doctors expect some side effects from medication. And let us go back to grammar here. So let us focus on the use of modal verbs can and may. So you know that can and may, they are very similar in meaning, and it can be used interchangeably. But let us focus on the difference in the use of these modal verbs to show that a drug or medicine causes side effects in some people. It is important to understand the difference between these modal verbs can and may. So they both express possibility, but can shows a theoretical possibility, something which can happen in theory, may happen or may not. And may expresses a real possibility that we face too. And the examples here are very similar, but different modal verbs are used here. The door can be locked. It means it is possible to lock the door. Right now, it is either locked or unlocked. So it is possible to lock and unlock this door. And the other example says the door may be locked. It is possible that the door is locked right now. So we come at the door, we are coming to the door, and we say it may be locked. If it is locked, we won't be able to open it. So we face the situation, and so we worry about this. There is a higher possibility here expressed with the use of may. And so more examples and more information about can here. Can is used to say that a side effect is possible, like this medication can cause some stomach irritation. It is possible for this medication to cause some stomach irritation. Here can indicates that stomach irritation is a possibility to reassure patients you can emphasize that the side effect is theoretically possible, but not of serious concern to a patient you are talking to. This occasionally causes stomach irritation in some people, not always, not with all the patients. Or sometimes people get stomach irritation with this, but it isn't usually a problem. This is what the doctor means when he uses can when he speaks about side effects. And on the other side, if we use may also expresses that a side effect is possible, and in this sentence, like this medication may cause some stomach irritation, it is possible that this medication will cause some stomach irritation. In this case, may indicates the possibility of the statement being or becoming true. So it will be true. And the word may in this sense is frequently stressed and indicates that stomach irritation is a strong possibility. So you may want to emphasize this. There's a strong possibility that this will upset your stomach. So if we compare can and may, in when it is likely to happen, we should use may. When there is a just not so strong possibility, we can use can. Well, and so there is a practical exercise here. We should use the words to complete the sentences. So possibility, may, will, can, probably, may not. So, let us listen to whom? Who was the last person to speak? I don't remember.
Nishat.
Nishat, you were speaking. Yes, Prakriti, please.
Yes.
What do you think of the first sentence?
May I?
Prakriti?
Yes, ma'am.
So read it, please.
May also express that side effect is possible.
I mean, which slide do you see? Do you see the exercise? Prakriti? No?
In same people,
Huh? Okay.
no, mama,
Yes,
in
read
same
it.
people, ma'am, in some people it can cause a fleeting headache, but it doesn't mean you dash get one, ma'am. You will get one.
Okay. So
In some people
just
it can cause a,
mhm.
yes, ma'am.
So please, yes, each phrase should be used only once. Now, please, this is an individual task. Do it in writing, please. And a couple of minutes for you to do this. Please start, please. Are you done?
Yes, ma'am.
Mhm. Well, so we agreed that in the first sentence we should use will, yes? It doesn't mean you will get one. So
Or
the
ma'am,
second, yes?
may
Can
you may
it
get
maybe
one.
can make
You
can
can.
get one.
Doesn't mean you can get one. It
Yes, ma'am,
doesn't
you
mean.
can get one.
Get one.
Uh-huh. So remember that we should use each phrase only once. Mhm. Okay, so the second sentence, Nishat, will you read it?
Yes, ma'am. Theoretically, this can cause low blood pressure, but you probably wouldn't have a problem. Probably, ma'am.
Probably for sure, yes.
Yes.
Almost 100%, okay. So the next is for Prakriti, please.
Ma'am, some people get blurred vision, but it dash happen in your cases. Ma'am, may not. Ma'am, may
Mhm.
not happen in your cases.
Okay, great. So Samhita,
There is a strong dash that this will upset your stomach. In fact, it may make you feel ill. There's a strong possibility.
strong possibility, yes, good. The next is, well, for Rafael.
Yes, ma'am. Swelling of the ankle is not common, but it is possible. It may happen, or it can happen.
It can happen is better. So because is not common, the possibility is
Yes.
not very high. It is possible, it can happen.
It can or it can also.
Yes, ma'am,
Yes.
it can happen.
It's better to use. So I mean, please, the last sentence here.
Yes, ma'am. This dash make you feel dizzy, so you should be careful when you drive. So, ma'am, it should be this will make you dizzy, feel dizzy. So you should be careful when you drive.
Mhm. Or there is, if for example, we have already used will in the first sentence,
Yes,
instead
ma'am.
of
No,
what should
may
we
we
use?
have used
This
in
may
first.
this
May.
make you or this
May.
can make you.
Yes,
This can
there
make
is
you.
a strong possibility. So you should be careful when you drive. Yes. So
Yes.
the possibility is stronger in sixth sentence than in sentence number 5. That is why in sentence number 5 we use can and we use may in the last sentence, number 6. So this is the difference. Okay. And so there is also a writing task to write sentences about the benefits and side effects of the sedative diazepam using similar phrases like in the previous sentences. In some people, theoretically, it can cause, some people get, there is a strong possibility. This may make you, in some cases, tablets can. So use the similar phrases. Just do you remember which group of drugs diazepam belongs to? You remember we were speaking about different type of drugs. So let's remember. I don't
Yes, ma'am.
remember. I need to go back to my notes. So diazepam is belongs to
Tranquilizers, ma'am.
no. I mean, yeah, this is sedative or hypnotic sedative, yeah. So it belongs to sedative type of drugs. Just write the sentences and you'll be also given just 3-4 minutes to write. Start, please. Do it individually. So it's time to check who would like to speak.
Can I?
Your name is? What's your name?
Prerna.
Prerna, please. Mhm.
In some cases, the tablets can cause dizziness or sedative effects. And some people might feel tired or drowsiness or dizziness. And there are the third sentence is not very sure. So the fourth sentence, theoretically, this can cause again that sedation.
Ma'am, can I try?
So you are speaking about it can cause it will cause just sedation, because this is the purpose why the tablets are used, right?
There
So-
are some serious side effects also of this is this diazepam medicine, as it leads to some it leads to it can lead to depression.
Mhm. I see. Okay. One
Yes,
of the possible side effects. Okay. Well, the other ideas, please. Who can just
Can I
add?
add?
Yes, your name is what?
Nishat, ma'am.
Nisha, please.
Yes, ma'am. In some cases, like the tablet can increase the risk of serious or life-threatening breathing problems or coma if used along with certain medication. And some people can have other diazepam side effects, which include a drowsiness, a tiredness, a fatigue, and and muscle weakness. And there are some people like they use this medication for alcohol withdrawal, anxiety, and as an antidepressant. Theoretically, this can cause an effect of relaxation, calmness, or maybe even euphoric.
Can I add to the last
Okay.
point?
Yes, your name is Rafael.
Yes.
Yes.
Theoretically, this can cause headaches, trouble in urination, and disturbance in sleep.
Okay. And you
Ma'am,
say
can I add to the
it can cause, because this is in theory, right? Yes.
Yes, ma'am.
Who else just want to add something? Your name? What is your name?
Ma'am Samhita, I want to add to the first point.
Yes, Samhita.
In some cases, the tablets can actually this. In some cases, the tablets can cause mood swings in a person.
Ma'am, can I add to the second?
Yes, you are right in the use of can, because it's not they will not necessarily cause this. Yes, I mean.
Yes, ma'am. Ma'am, in some people, diazepam, ma'am, it may cause memory problem, hallucination. Hallucination is compulsory, but trouble in walking or agitation, ma'am.
So in this case, it's better to use can, because the possibility is not very strong, right? It can
Yes,
cause
ma'am.
in this case. Okay, good. So, and there's one more just piece of information. This is the example of some clinical incident reporting. You know that sometimes doctors don't like speaking about this, but sometimes there are some cases of overdose or just the wrong prescription of some medications, and this is called clinical incident, and they should make some complete some reporting form, and here is the example of such clinical incident reporting form. Let us just read this piece of information, and let us listen to Arun Chalam, please. What is given here on this slide?
Yes, ma'am. Writing clinical incident reporting, read the sample clinical incident reporting form. The name of the staff involved, CJ Flint. The grade and specialty, PRHO medicine. And the agency, locum, N. Marie. Brief details of the incident. Patient was prescribed Augmentin 625 mg 8-HPO despite penicillin allergy. This was stated on the drug chart. This was noted by the pharmacist, and the patient did not take any Augmentin. The team PRHO was contacted and an alternative antibiotic was prescribed.
So this is the information about this cake, this incident. And you see PO, what does it stand for? PO. Who remembers?
To be taken orally.
Yes,
Twice a day.
by mouth, orally. And okay, So, so they found the way out of this situation. And so the fact is just written here in this form. And if we have a look at the next slide here, here is the, here are some notes about another incident. And we should complete this clinical incident reporting form. It was a near miss incident. So make up just full sentences out of the notes which are given here. There is the name of the drug, the way how it is given, how much, and what happened. So please look at the notes, analyze the notes, and write full sentences as it was done on the previous slide. So a couple of minutes for you, please. Do it now. Okay, so let us read what we've written and let us listen to Madhumita. Please, what did you write?
The patient was prescribed flumazenil 200 mcg through IV up to 1 mg, ma'am. The drug chart or the patient is what is the meaning of epileptic, ma'am?
Epileptic, this is the name of the disease.
Seizures.
Disease.
Seizures.
Mhm.
It's epilepsy, ma'am.
Yes. Mhm. Okay.
Then
What was yes, Priya, will you help us?
Yes, ma'am. Patient was prescribed flumazenol 200 mcg through IP up to 1 mg. 1 mg despite penicillin allergy. This was noted that Duncan patient did not take any flumazenil. The doctor The doctor's Zoe team contacted and alternative drug was prescribed.
So Dr. Zhou prescribed this medicine, yes, but Dr. Duncan noticed this and okay. Yes, so this is the example of the clinical incident reporting, and I would like to speak about the midterm